I chose this program because I had a wonderful experience here as a third-year med student when I was doing my MetroPAP rotation, and I got to spend time with really wonderful faculty and specialists and staff who were excited to engage in teaching and supporting learning. And this supported my practice goals because I wanted to get trained in full spectrum family medicine, and I knew that Creekside and Methodist would be a great place to do that.
Minnesota is special because it really works to get medicine as good as it can be in a way that's cooperative, considers the whole person, and really communicates between specialties and primary care so that we can do our best to optimize health for our patients.
Certain aspects of the program that I really appreciate are, one, the curriculum and the structure of the rotations they have. I think it's a lot of great inpatient learning at the beginning. It feels like that fire hose effect, but we get a lot of high input, variety of information, medicine during that first year, and then we slowly transition to more specialized, capturing our interests with different electives, rotations that we're doing, and faculty support with that. We get to explore a lot of things that we'll be incorporating into our future practice towards the end of residency. And for me personally, getting to kind of hone in on my clinic experience, patient care, and clinical efficiency.
Our outpatient training is astounding. I think that's a commonality amongst a lot of family medicine programs, as it should be. I also think that we have astounding inpatient training at Methodist Hospital. We have an open ICU, we have a cath lab, we're a stroke center, and so we see very high acuity patients and manage those patients in the hospital alongside our critical care colleagues. And I also think we have an outstanding obstetrics program.
We deliver many babies at our hospital, enough so that other programs try to get their residents to share in some of the experience. So no matter your future within family medicine, we can offer a diverse and exceptional training experience.
One of the highlights of the Creekside Clinic, I think, is our diverse patient population. We have a large Hispanic and Somali population, as well as a large Bosnian and Russian population. So the residents get to experience different cultural approaches to having to take care of patients. Our main goal is to graduate well-rounded family physicians. So if you're looking to be able to practice in really any kind of setting, rural, urban, do OB, not do OB, have a strong base in musculoskeletal care, feel very comfortable taking care of children and the elderly, this would be a great choice.
A day in the life as a resident is different every day. We learn to be really adaptable. I would say now as a third-year resident, I spend a lot of my time in clinic seeing patients that I've kind of built relationships with over the past several years. It can be a variety of outpatient experiences, shadowing different specialty providers to learn more about what they do, how we can incorporate that into our primary care practice, and then what to refer on to the specialist itself. There's all sorts of things about call shifts, overnight rotations, obstetrical deliveries and rotations. But I would say that's a typical day in life as a clinic day and learning more from some of our specialists within our healthcare system.
What I appreciate most about Methodist is the fact that as an intern, we are running code blues, stroke codes right alongside with the specialists. I feel very well prepared as a future rural physician to handle any situation that comes my way. And over this course of my intern year, I feel like my confidence has really blossomed.
We've got a really large, diverse faculty group, and that offers opportunities in all aspects of family medicine. We've got faculty who specialize in sports medicine, geriatrics, community and global health. And so eventually finding your faculty mentor and advisor, they can help steer you to shape the program training to whatever you might need for your future career.
As far as living, learning, and practicing in Minnesota goes, the thing I like the best about it is that we are within a large city population overall, and so we see a lot of high acuity things. We get a lot of hands-on practice. But at the same time, we're also not far from a lot of green spaces, a lot of parks, a lot of lakes, the North Shore, a lot of things that go a long way, I think, for physician wellness and resident wellness as well.
It's hard to capture without being here, but it's important to know that Methodist has a very special culture to it. There is a real sense of camaraderie, teamwork, mutual respect that enhances learning, but also just delivers the best patient care because we're all focused on the same purpose. I think it's really hard to replace that, and it makes for an ideal learning environment.
I would tell a prospective trainee who's considering Methodist that you should definitely come here. I've had a wonderful experience. You should feel very secure in your training and know that everyone is going to invest in you and nurture you and help you grow and achieve your dreams. And I hope that you would have as positive of an experience as I have had here.